Yeah.
Good afternoon, and I'm here with Dr. John C. Gutleber, and we're here to ask him brief questions on prenatal care. So, doctor, how important is it for a woman to receive prenatal care, and how early should she start, and why?
It is extremely important to take prenatal vitamins and to have prenatal care. Before a woman becomes pregnant, she should already be taking vitamins. Vitamins such as folic acid have been shown to decrease significantly the risk of having spina bifida, which is a spinal defect where the spine is left open. Recent research has shown that folic acid supplementation may also decrease the risk of having a child with autism. Also, there are many conditions that a woman may have that may need to be treated prior to becoming pregnant. She should be treated for hypertension. If she has diabetes, the diabetes should be under control, or any other medication. A woman should also be tested for many diseases, such as HIV. If you have HIV and you treat the woman during the pregnancy, it dramatically reduces the risk of a child being born with HIV. So it is very important. So before a woman becomes pregnant, she should already be set up to have that baby. If she discovers that she is pregnant, she should see her gynecologist as a first opportune time. Because there are many things that need to be done, many tests that can detect possible birth defects, so it's very important.
And what would you say are some essential vitamins needed to have a successful pregnancy and a healthy baby?
Well, we all need essential vitamins. We all have these micronutrients that we need in our diet. If we don't have them in our diet, our body will not be working well. If we're going to make a new baby, a new human being inside of us, we need everything to build that baby. So we need a little bit of everything. So it's very important. It's very important to have a varied diet. It's a little bit of meats, a little bit of vegetables, a little bit of fruits, a little bit of nuts, a little bit of whole grains. It's very important.
So a little bit of everything will
Yes.
be very healthy.
Everything in moderation.
Okay. What types of foods should a woman intake, and what should she avoid?
Well, you want to eat good foods. Just as our everyday living, we should always be having good whole foods, non-processed foods. We should avoid things such as sodas, diet sodas, anything that may contain chemicals. One problem is deep sea fish, such as tuna, may contain mercury. So if a woman is pregnant, she should really avoid having any kind of fish like that, such as tuna or mackerel or swordfish or large sea predators, because they may contain high levels of mercury, which can lead to a problem with the baby.
And these type of foods, should they avoid them altogether, or could they have these in moderation?
I would say stay away from
Stay away. Okay. So now that we've talked about common foods, things that pregnant women should intake and should avoid, let's talk about vaccines. What vaccines would you say are not safe for a pregnant woman to take during her pregnancy?
There may be a risk with MMR. There may be a risk with the varicella vaccine, which is for chickenpox, and the flu zone, which is a live influenza vaccine. The regular influenza vaccine by the shot is okay because that is a killed virus.
And what would you say are the effects of a woman receiving these vaccines?
Oh, just with everybody. When we're vaccinated, the body thinks that it's being infected, so it mounts a response against that pathogen, although it's not a live infection, so it's not going to infect the person or the woman. But she will have things such as maybe aches and pains, maybe a little bit of fever. You feel like you're coming down with something, but you don't.
Okay.
We all experience it when we get vaccines.
Okay. And what are the consequences of substance abuse to an unborn fetus? And also, if you could elaborate on fetal alcohol syndrome, substance abuse, and possibly even mental health drugs?
About 4% of children are born with identifiable birth defects. We do everything we can to prevent any kind of problems. On all medications, they're rated category A, B, C, D, and X. Category A means it's been tested in pregnant humans and is found to be safe. Category B means it's been tested in animals, it's found to be safe, and is probably safe in humans. Category C means that it's been found to have problems in animals. Only use it on a human, on a woman, if it is needed, such as a medication for diabetes diabetes or hypertension. She needs to control that during a pregnancy. It may possibly cause a problem with the child, with the fetus, but it's essential that the woman receive that for her own health, that she has a healthy baby. So we're all in category D means do not use it during a pregnancy because you will have a problem. Category X means it's absolutely contraindicated, and you probably will cause a birth defect. So if we're worried about these medications that are regulated and are relatively safe, using substance abuse such as cocaine or marijuana or alcohol or any other kind of drug like that is a no-brainer. Nothing like that should be done. And besides normal, good, healthy behavior, we should avoid things as that. The same thing with alcohol. Alcohol causes known fetal alcohol syndrome, which leads to multiple birth defects, can lead to mental retardation, can also cause facial cranial defects that you detect in a child, and it may lead to behavioral problems. The same thing with cigarette smoking. If a woman smokes during her pregnancy, the child is addicted to cigarettes. So the first few weeks of that child's life, that child's going to be cranky because it needs a cigarette. And then, when the child becomes a teen or an adult, they're more likely to be addicted to cigarettes or other drugs. So all these things should be avoided, and it's imperative.
Okay, so it is safe to say that all these things for an unborn child could be highly addictive, or
Yes.
addictive to the child.
Yeah,
once
they will.
born.
With the child, so the mother's taking any opiates or any benzodiazepines such as Xanax or Valium or Ativan. When the child is born addicted to it, and the child has been experienced after the pregnancy. And all these things may lead to a low birth rate. It may lead to an early early delivery, premature delivery. I've seen it myself. I worked in a hospital in New York City, and there was a lot of drug use, and the neonatal intensive care unit was filled with babies whose mother had used cocaine. Causes tremendous, tremendous problems. Socially, to the child, and it cost $1 million to get that baby out of the neonatal intensive care unit, just because someone chose to abuse drugs. So in addition to the problems it caused to the baby, it also causes problems to our society.
Okay, well this concludes our interview with Dr. Gutleber. Dr. Gutleber, thank you so much for your expertise in
It was my
prenatal
great
care.
pleasure.
Thank you.